Dr. David Lam, what do you think of Henry's comment just then? Do you think the problem is getting worse? I mean, the waiting time at public hospitals?
The waiting time for emergency consultations at A&E departments has been more or less the same all these years. We have a surge in the number of patients attending during flu seasons. And this year, of course, it is not a flu season, it is a COVID season because we are seeing an increasing number of COVID cases in the past several weeks. Although there seems to be signs of slowing down, I don't know. But then that is what we have been facing for many years. And now, I heard from what Danny just said about the primary health care blueprint. That may or may not help the situation in the long run because the hospital authority A&Es are seeing basically all sorts of cases from the real emergencies to the relatively less urgent cases. If you visit places like Australia and you have a common cold, which is not severe, and you have no fever, and you try to get into one of those emergency departments, the nurse there will stop you and just ask you, why don't you go to see your primary care doctor or to get some medicine from a pharmacist? But in Hong Kong, we have asked the hospital authority several years ago, why can't they do the same? That is to ask people who do not have urgent situations to attend their own family doctors. But then the response was that they see everyone. So that leads to what we are now seeing when, in times of stress, the waiting time is getting longer and longer. So what we hope to see in the long run is that we have more people going to their family doctors when they do not have urgent situations, and we have good diversion nurses at the hospitals, authorities, A&Es to divert people away when their situation is really stable. So those sorts of things might work. But again, when we have a flu season every year, then we are always under pressure.
Right. In the first half of the program, Dr. Lee and also Mr. Lam, they both expressed concern that after the mainland border reopens, the situation may worsen. Do you share their view, Dr. Lam?
No, we are opening our borders to the rest of the world, except we have a very limited passage through to mainland China in the past several months. And what we see is that about 4 to 5% of the new cases every day are imported. That means over 95% of the cases are local. And the bulk of the case is really putting pressure on our medical system and not the 4 or 5% of the cases who are imported. When we fully open our border with mainland, yes, there may be a possibility that more people are coming back to Hong Kong who are really Hong Kong residents. And when they come back, they may be carrying the virus, although they may have a full-blown illness, and in a few days' time they may go to visit the emergency department, and that causes some sort of pressure to our system. Yes, it may happen. And I agree that we have to make sure our contingency measures are adequate to address this issue. But I do not think the number will be like a huge amount of work. But yes, there would be some pressure.
Let's go back to Alex Lam on that, because Alex Lam, you were saying earlier that you're a bit uncertain about what kind of, or you're a bit concerned about what kind of contingency plans have been made. Is that right?
Yes. After listening to Dr. Lee, I didn't really hear from him as to what the contingency plan would be in place. But seeing the huge number of bed occupancy, talking about 120%, it's not a good sign at the present moment. So if there's a further increased number of patients requiring bed service in the hospital, that we're concerned that how the medical system will handle the situation.
Dr. Lam?
Mm-hmm.
I saying that, and we've heard this earlier on, that the worry, although you talk about making contingency plans, it's not really clear what actual contingency plans are being made.
No, we're not clear.
You're not clear either. So you would share Alex Lam's concern that there's more.
We've been calling the government to make it open, so they're more transparent, so that people understand what the contingency plan are. But what we've heard so far is the hospital authority will deploy more people to the emergency room to help out But how that is going to be done, we're not quite sure. And what are the numbers, we're not quite sure. And the hospital authority also mentioned that they will be cutting non-emergency cases so that more manpower can be diverted to the emergency rooms. But again, how far is that going to affect our usual non-emergency services? Again, we don't know. So I would wish to see more transparent plans, yes.
And looking ahead, this is going to be the new normal, isn't it? I mean, COVID's not going away, and COVID is normally going to be worse in wintertime, like other respiratory infections. So hospitals which in Hong Kong and around the world, which has struggled before just with flu surges in winter, every year they're going to be dealing with both flu and COVID, right? So these problems are going to come back again.
Yes, in a way, yes. But we do not have a flu surge this year. If you look at the numbers, it is really a very low figure in terms of flu, and the vast majority of our cases are COVID so far. Of course, we still have a few months to go with respect to the flu season. So, yes, if the flu also comes up together with the COVID, then that may be serve as a severe blow to our rather brittle emergency room surfaces.
Because if we look around the world, there are plenty of other countries. America, they talk about the tridemic. There are plenty of other countries which are facing simultaneous flu and COVID surges. You're saying we're lucky in Hong Kong that hasn't hit us so far this winter, but it might come later this winter. And by the law of averages, it's going to come. If it's not this winter, next winter, or the winter after?
Yes. But we don't know how severe is that COVID going to be in a year's time, or even 3 months' time, when we have new strains popping up now and then. And the strain so far seems to be getting kind of more milder, although because of the sheer number of cases infected, you still see a great number of severe cases and maybe mortality cases in hospital, which is certainly another pressure on our system, because COVID is much more transmissible than flu as of now. So that is a worry. Yeah.
So the hope is that by the time you get hit by a twin surge of flu and COVID will have evolved into an even less serious threat. Is that what you're saying?
Well, it has been going that way, but we can't be sure because things can turn around and get more severe. So eventually the answer lies in vaccination and adequacy of all sorts of drugs, including antivirals. And luckily we do have enough antivirals at the moment. And the vaccination rates of COVID is pretty high, although those over 80 years of age and those who are in the early childhood or infancy, they are still relatively low in the vaccination rates, which we have to step up. But then the vaccination rate for flu has always been very low in Hong Kong, and that is something we should do. If we can step up the flu vaccination rate as much as the COVID vaccination rate, then I would hope to see a much less severe flu surge in the years to come.
Right. And earlier, Dr. Lam, you said you're hoping to see more transparency from the government too when it comes to a contingency plan. What's your view? I mean, what should the government do to deal with an expected surge in demand for medical services?
Now, for many years, the government only focused on the hospital authority and their own departments of health. But we understand half of all our doctors are working in private practice, and half of those doctors who are in private practice are actually family doctors or GPs. So you should always remember they are there, ready to help. And of course, you have to purchase service from them if you want them to help, but it is always possible. And for a long time, that has not been done. Now, during the COVID pandemic, the government has changed their mind a little and recruited primary care doctors in helping with, for instance, the designated clinics, the AWE holding centers, and also taking up some of the work inside hospital authority and also telemedicine. But that seems to be rather fragmented and insufficient. So we hope to see in the long run, primary care actually takes up a much bigger role in terms of preventive care for infectious diseases as well as the treatment of milder diseases. So that would really make full use, or at least a better use, of all healthcare manpower in the community, and not only the 50% who are working in hospital authority and the departments of health. Now that increases our human resources significantly if we can use them cleverly. That is not something we are seeing yet.